Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
Mrs. Maxwell is a 75-year-old patient with neurocognitive disorder due to Alzheimer's disease. She lives with her son and his wife and generally does very well with her day-to-day activities. The family understands the importance of routine, and Mrs. Maxwell maintains a regular schedule of activities, including her meals, timed toileting, and recreational activities. Which of the following behaviors should prompt an immediate depression screening for Mrs. Maxwell? A, an acute change in mental status. B, angry verbal outbursts that seem unwarranted. C, death of her best friend. Or D, an unplanned weight loss despite consistent oral intake. And so, again, this is an excellent example of how sometimes multiple answer choices really may appear to match the scenario with which you are presented in the question, and you can find yourself confused, thinking, boy, several of these seem to fit. No, what do I do with this? Where do I go? That's where you go back to the question and make sure that you are answering what it is asking of you. Make sure you really zoom in on exactly what it's asking of you. So let's dissect this question a little bit. This lady is a 75-year-old patient with neurocognitive disorder. Now remember, neurocognitive disorder is what we typically used to think of as dementing disorders. The DSM-5, back when it first became DSM-5 in 2013, I realize we have the DSM-5 TR that was published in 2022, but DSM-5 in 2013 produced some major changes as compared to DSM-4. And one of them was really recharacterizing or reclassifying what we used to call dementing disorders as neurocognitive disorders. The DSM-5 and, of course, the DSM-5 TR has a chapter on neurocognitive disorders. And the three neurocognitive disorders are delirium, minor neurocognitive disorder, and major neurocognitive disorder. And the real difference between minor and major neurocognitive disorder is the patient's ability to live and function independently or not. So Alzheimer's disease, the artist formerly known as Alzheimer's dementia, but now more appropriately Alzheimer's disease is a physiologic anomaly that can produce disorders of cognition. And when those disorders of cognition begin to interfere with day-to-day function, then the patient has a neurocognitive disorder. So Alzheimer's disease is the most common cause of neurocognitive disorder, and it suggests a patient who cannot function independently. So this lady lives with her son and his wife, and like the question says, she does very well with day-to-day activities, which is huge for patients with Alzheimer's disease. Not as much so with people who have neurocognitive disorder for other etiologies, but with Alzheimer's disease, maintaining routine is critically important. And as the disease progresses, it's more and more important that the patient be able to maintain routine. So thankfully, the family understands the importance of this. You can see in the question, Mrs. Maxwell maintains a regular schedule of activities, including meals, time toileting, and recreational activities. But the question for you is, which of the following behaviors should prompt an immediate depression screening for Mrs. Maxwell? In other words, what should prompt an immediate depression screening for any patient with neurocognitive disorder due to Alzheimer's disease? And the correct answer to the question, the best answer of those provided, is B, angry verbal outbursts that seem unwarranted. Mood disorders in patients with Alzheimer's disease very often present as seemingly disproportionate anger. As a consequence of the pathophysiology of disease in the brain, the manifestation of mood disorder may just be a little bit different. And so when you have a patient with Alzheimer's disease, and remember, patients with Alzheimer's disease and neurocognitive impairment, that is their day-to-day mental status. This isn't, an acute mental status change kind of thing. This is their day-to-day level of cognition. When they develop angry verbal outbursts for no apparent reason that seems unwarranted, mood disorder is one of the leading differential diagnoses, and a depression screening should be implemented. So B is the best answer. When a patient with Alzheimer's disease develops increasing irritability, anger, a depression screening is definitely one of the first assessments you want to do. Conversely, an acute mental status change, like you would see with option A, an acute mental status change is delirium. And in the older adult, urinary tract infection is the number one cause of an acute mental status change. Remember, delirium is an acute global change in mental status. That's not the same thing as an angry verbal outburst. With an acute change in mental status, then what you have is delirium, and the patient should be assessed for causes of delirium, of which urinary tract infection is number one. Those of you that work with the elderly, particularly the frail elderly population, know what I'm talking about. Those of you who don't, this is a very important teaching point. When you have an older adult who has a global acute mental status change, the very first thing you do is a urinalysis. And if the urine is negative, then do a chest x-ray for pneumonia. And if that's negative, look for infection somewhere else, because it's usually infection. So A is not the correct answer here. Death of a best friend may trigger depressed mood, but absent symptoms, a screening is not indicated. I mean, remember, all people with depressed moods do not necessarily have a mood disorder. I mean, if your best friend dies, depression is a very appropriate response to that, and it doesn't require a depression screening. And then finally, an unplanned weight loss despite consistent oral intake. I mean, this warrants evaluation for organic disease. There are any number of metabolic or systemic physiologic phenomenon that can cause unplanned weight loss. I mean, it can be a malignancy, it can be a hormonal abnormality. There's lots of things potentially that can be going on there. So the best answer to this question, and again, the question very specifically is, in this patient with neurocognitive disorder due to Alzheimer's disease, what behaviors would prompt an immediate depression screening? The best answer is B. Could D be due to depression? Yes, but you have to rule out the physiologic things first. Could C produce depression? Yes, but it may also just be a normal response to grieving. And would A be due to depression? No, that's usually due to, could it be? Yes. I can't say it couldn't be, but there are many things that are more likely, and infection is certainly the first thing to rule out. When you look at these answer choices, you could make an argument for any one of them, but the best answer to the question is B, angry verbal outbursts that seem unwarranted.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.